The effort to repeal and replace Obamacare seemed all but dead in the water after Senator McCain killed the last effort. But the GOP hasn't given up on their 7-year promise just yet. Senators Lindsey Graham and Bill Cassidy are making a last-ditch move to get health care reform through the Senate with a bill that would end the individual mandate, scale back Medicaid expansion, and replace the Obamacare tax subsidies with block grants to the states. And now Politico is reporting that some Republican senators think they're just a couple votes away from getting the necessary 50. But the Senate only has about a week and a half to pass it. So can the GOP get their act together in time? And how much reform does this bill have in it? Joining me now, it's Reason Magazine features editor and healthcare expert, Peter Suderman. Welcome back, Suderman.
Thanks for having me.
So we talked a little bit about this last week, but that's when the whole thing was pretty much a hypothetical. Now, some of the senators supporting this bill say they've got 48 or 49 votes. What do you think?
I think it's going to be close, but remember, every one of these votes has been close. The Senate has always been just about to pass an Obamacare repeal or rewrite bill, and that's basically still where they are right now. I think that there are real reasons why senators might take a hard look at this and ultimately come out and say no. For one thing, it does a lot of redistribution of the Medicaid money, and that's something that we've seen a lot of even Republican senators object to in the past, and that is one of the reasons that the previous versions of the bills didn't make it over the finish line. A lot of that is still in this bill. In addition to that, it also leaves some of the pre-existing conditions rules in place while eliminating the individual mandate. Now, getting rid of the mandate is in many ways something that Republicans have wanted to do for a long time. But when you leave those pre-existing conditions rules in place,
how do you pay for that?
What you do is you set up a situation in which a lot of states are going to see their insurance markets crash unless they put in place something like the individual mandate, or unless they really try some stuff that we haven't seen any state try before.
But taxpayers will still be forced to pay for it. They can call it whatever they want, but it's still essentially coercion. So they still have not come up with the perfect plan. Now, there were elements of this that I really liked, and there has been a libertarian solution to the Medicaid problem for years, and that has been block granting money to the states and allowing states to best dole out the money to the people who really need it, because as you know, not every state is Maine or Alaska, and those states tend to have much higher Medicaid needs. So how can you do what needs to be done without the individual mandate? Is it possible to do that and keep some safety net for pre-existing conditions without collapsing the individual state-to-state markets?
Every state that has tried has failed. That doesn't mean that there's no way to do it, but we haven't seen one so far. I think you might see states try to do things like set up waiting periods. I mean, Obamacare already has a system where you can only enroll during a certain part of the year.
Yes.
Some of the previous Republican bills have said, well, you have to wait 6 months, you have to wait a certain period of time if you go without coverage, and that would give people an incentive to stay signed in to the program. But we've never seen it happen, and so it really puts us into the zone of the unknown. On the other hand, what it does is it takes this, I think, kind of small government, limited government idea that local accountability and local control are better and says, look, Republicans in Congress promised to repeal Obamacare. We're not going to be able to do that. Instead, what we're going to do is we're going to take the same amount of spending, and what we're going to do is we're going to let states manage it instead and see if they can fix these problems that Congress has failed to fix.